Stuart's puking. Oh my gosh, that's funny. Wild clone confrontations. These look very suspicious, and good old Dr. Wagner making an appearance. What? Get ready to laugh, because today we're breaking down and reacting to some of the funniest medical scenes and absurd injuries from Family Guy. Let's dive right in.
What happened to your clothes? Hey, what are you doing?
Oh. In the emergency department, we actually do have to deal with batteries being ingested or put in certain areas. These type of batteries, not as bad as button batteries, could be quite caustic to our body, get stuck and start eroding and causing perforations in our GI tract somewhere.
Brian, have you seen... Whoa, what the hell happened to you? Well, easy, man, easy.
Wow, interesting. Strangulation, you're cutting off blood supply in and out of the brain via your carotid artery and your jugular vein. And then you're also compressing down your trachea. So the trachea has cartilage. It doesn't go all the way around, which makes it easily compressible.
Don't you see, Brian? My machine did work. It created an evil clone of me.
Stewie here has cloned himself. I know back in like the 90s, they were able to clone the sheep, Dolly. You think they've cloned humans since then? Why don't we all put on our tinfoil hat and let me know in the comments what you think.
We're going to run a few tests on...
Oh. Remember, when you get a bloody nose, pinch the nose and lean forward. Do not pinch the nose and lean back. If you lean back, the blood's going to trickle down the back of the throat into your mouth. You're going to spit it up. You might get nauseous to where you vomit. Oh, no way. I've never seen this episode or heard of this episode before. That is crazy. Do not cut the dog's tail. It's part of like their spinal cord. You can even see the bone that is in there. Oh my gosh, I can't believe they put the tail in the mouth. It's like pin the tail on the Stewie. That is awful. Having traumatic head injury, you already see a black eye forming, a bruising to the head, and then with that, you can even choke on the foreign body that is in the mouth. And I do like that he's pulling on the few strands of hair. It's kind of funny. Stuart's puking. Oh my gosh, that's funny. Poor Brian trying to stick his tail back on. If there's enough blood supply, you could potentially reattach this as long as there's no other higher level function going on, but you have to attach all the different components, the muscles, the blood vessels.
Oh my God, a baby! Are you okay?
What? Look at the anatomy. They do a pretty good job. The separation of like the nose, the oral pharynx, the brain, and all the tissue and skin around it, and then depicting bone. It's actually pretty good.
I'm Dr. Wagner.
Stop it! There's a Dr. Wagner in Family Guy? I didn't know this. Why didn't anybody tell me this? Kind of looks like me a tiny bit.
This is so stupid. You're stupid.
Guys, please.
Admit you exaggerate your accent. Admit you wear shirts from museums you've never been to.
Psychiatrist, psychologist. In the emergency department, we don't deal with these situations often. We would end up dealing with the injuries if they got into a fight in the office or, say, in the hospital.
It is my opinion that you should end this friendship.
What?
Fine by me. Makes my life easier.
Also, your insurance card didn't go through, and when I looked again, I realized it was a Robex juice card.
You went to SUNY Albany. You'll take it and like it.
I don't think a professional should weigh in so much on their opinion when it comes to this aspect. You typically want somebody to come to their own conclusion versus you actually telling them what to do.
This is not good. No one knows we're out here and we got no food or water.
Relax, Quagmire. There's food all around us. The trick is just knowing what's safe to eat and what's not.
Oh, jeez. Don't...
Okay, these are a maybe.
There are some different disease processes that cause like a desquamation or a dryness and cracking and pulling away of skin around the mouth, Kawasaki's disease, but toxins, there's a whole other specialty within emergency medicine called toxicology.
I feel dizzy.
Oh.
Me too. This all happened so fast.
No, she feels dizzy, bro.
Yes? Are you okay?
In general, if you feel dizzy, you get tunnel vision, sit down, lay down. These are the precursor signs that something's going to happen, typically a syncopal episode. A lot of people have the sensation that they want to run away and then they fall. Lay down, sit down on the ground, get blood flow to your brain. You will feel better.
Jess?
So lay Jess down all the way on the ground and double check to make sure she's breathing. Make sure she has a pulse.
Are you guys still leaving?
Oh, yeah, sorry.
Not so much. It's a good depiction of how difficult it is to move a human being. We are heavy and awkward to try to lift and move.
I'll come right out and say it. The cancer did not respond to treatment and has spread throughout your body. You've got approximately 2 weeks left to live.
It's so interesting when we put a time on somebody's expected life. It is a very rough estimate. It is not written in stone. Unless there's like an immediate reason that somebody's going to pass away within the next 30 minutes to a couple hours.
So, what seems to be the trouble?
Dr. Hartman, something's wrong with me.
Oh.
Everyone's treating me like I'm a broad. I don't know what's going on.
I can totally understand how going to the hospital or doctor's visits can make people stressed. If you're dealing with the occasional stresses of normal life, that is where Chillax by my company Life Happens comes into play to support relaxation and calm racing thoughts. Check it out at lifehappens.com or on Amazon.
I recognize that hysterical tone of voice. Sounds like someone's having their monthly.
Oh my gosh. Dr. Hartman, you all know my opinion on Dr. Hartman, basically stating that it's the potential female menstrual cycle.
All right, sweetie, let me just spit on my hand and we'll get started.
What the heck? Potentially a pelvic exam. You should be using gloves. You should have a female chaperone in the room, have the patient covered appropriately. And also, you want to make sure that when you're doing this type of exam, the patient is not facing the door in case somebody comes in.
I wouldn't be standing here right now if it wasn't for you.
Oh, shnikes. Getting hit by a truck, you think, okay, massive internal injuries, fractures, and bleeding.
She's right in here, sir. Just tell the disorderly when you're ready to leave. Don't you mean the orderly?
The orderly. We don't even use that term anymore, the orderly. And it's not disorderly, it's orderly.
Brian, I don't have much time.
We have the EKG machine, which is only showing 1 beat per screen. Maybe it has a number hidden somewhere on that monitor, even though it says 0. Even if the monitor says it's 0, check the patient to make sure they have a pulse.
I never should have made you leave the house. This is all my fault.
Shh. Don't be so hard on yourself.
The nasal cannula, it almost looks like the one from Dune, only one-sided with the double prongs to the nose. The normal one nowadays is a loop, so the prongs go into the nose, but the tubing comes out both sides.
I only wish we could have a little more time together.
Quite interesting that she doesn't have any outward injuries, but she did get hit by a truck. Family Guy, always quite entertaining, and I can't believe there are still scenes that are medically related that I've never seen before. Super cool. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything as always. And do me a favor, keep this channel going and growing. Subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.